Entry-Level Home Health, Plan of Care and Clinical Documentation Essentials by Peter B. Sims. Let's start this off. First essential element in the home health plan of care is the goals section. Each medical record and each evaluation must have short and long-term goals. All of the goals must be functional. Let's give an example of Mrs. Jones. Mrs. Jones wants to participate in all medical appointments. Can your goals help her achieve that? She also would like to perform all self-care duties. Are your goals reflecting this? She also would like to communicate her wants and needs. Will your care help her achieve this goal? She would like to participate in meals with the family. Will your goals help her achieve this? Finally, all plan of cares must have a patient-centered goal. An example of this is, I want to drive again. Next, objective standardized test. Every plan of care must have an objective standardized test. Let me give you an example of 3. For the physical therapist, we'll provide the timed up and go. Example of one of these for the OT is the Barthel. For speech language pathologist, the Montreal Cognitive Assessment. Let us move on. The home exercise program. Every patient must receive a home exercise program. They must be instructed in it at the evaluation. They must perform it. And if there is a caregiver, they must be involved in it. This must be documented in the evaluation and each subsequent visit, the patient and or caregiver's involvement and participation in their home exercise program. By the end of the plan of care, this goal must be met. Compliance. The patient must buy in to their plan of care. It's a key to successful outcomes. Compliance. Make sure you check in and document patient compliance each and every note. Compliance must exist to continue care. Care coordination. Who, what, when, and why. Communicate and document care coordination. Examples of care coordination can be discharge planning, clinical changes, adverse events, and/or abnormal findings, medical appointments. Figure out who you need to communicate, what you need to communicate, when, and why. Caregiver training. This must be documented each visit. An example of caregiver training could be teaching the caregiver the home exercise program, teaching the caregiver safety and preventative education strategies. Finally, teaching patient management, transfers, body mechanics, etc. Discharge planning. As we all know, discharge planning starts at the evaluation. Please communicate and document your DC planning in each and every visit and in each and every note. Plan for next visit. This must be communicated and documented in each note. Continue with plan of care. That is never acceptable. Don't write it. Examples for next session. Upgrade home exercise program to include standing dynamic balance training. Another example for the next session for Mrs. Jones is add 2 sets to supine closed chains Therex. Facilitate stair training. Progress skate without rest breaks with a single point cane. The final example of something you can add to the plan section for the next visit would be teach correct technique for car transfers. Homebound status. This is an eligibility requirement for every home health patient. You must confirm the Patient is homebound each visit, and it must be documented in the medical record. An example statement of homebound could be this: patient is unable to safely leave home unassisted due to decreased lower extremity and upper extremity functional strength, balance, and transfer abilities. Status post weakness exacerbation. The patient is dependent on another for safe functional mobility, and it is very taxing and unsafe to leave the home. Skilled care. This must be documented each and every visit. Example verbs for skilled care are to teach, to facilitate, to correct, to recommend, to prescribe. If you're doing these things in every treatment session, you're providing skilled care. Each visit must be verified. Obtain the signature and date from every patient. When you sign your note, write your full name with professional credential. You must date each note, and you must document the time in and out. Vital signs. When should you take vital signs? Take vital signs before, during, and after treatment. Monitor blood pressure and document it. Monitor respiration rate and document it. Heart rate, temperature, and pain. If you're going to take oxygen saturation, you must have a physician order to monitor and document. Thank you for your time. Take care.